All right. Hello, everybody. I'm Dr. Kaitlin Riegler, and today I have the pleasure of speaking with Dr. Christina Master. Dr. Master is a pediatrician and sports medicine specialist at Children's Hospital of Philadelphia. She has expertise in primary care sports medicine and brain injury medicine. She's also a fellow of the American Academy of Pediatrics, certification of added qualification in sports medicine, a fellow of the American College of Sports Medicine, and fellow of the American Medical Society for Sports Medicine. At CHOP, she works with the Division of Orthopedics, the Sports Medicine and Performance Center, and the Division of General Pediatrics and Primary Care. And Dr. Master is also a professor of clinical pediatrics at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia, and a co-director of the Mind Matters program. Dr. Master is going to be speaking at the upcoming SNS Symposium in Philadelphia in May, and she's going to be giving a talk titled Mind Matters, Seeing Concussion Through New Eyes. Dr. Master, thanks for being with me today and be willing to talk to me about your upcoming talk. So the title of your talk includes the name of a program that you're the co-director of at CHOP, the Mind Matters program. Do you mind briefly telling us about the program?
Sure. I think thanks so much for having me, and I'm really excited to be speaking this spring at your national meeting. It's going to be really great to see everybody there. So I really am honored to be invited, and it's great to have it in Philadelphia. So we're really excited to host you all here in our city. Minds Matter is the concussion program that we started back in 2011, and essentially was in response to the fact that there was increasing awareness that concussion was something that could have a substantial impact on kids' lives. And that was a time when all of the states across the country were beginning to pass return to play legislation to make sure kids were being safely returned back to sport. And obviously, we've learned so much in the last 14 years, I guess, in terms of that. And it's been a great experience for all of us at CHOP in that the Minds Matter program really encompasses the whole breadth of concussion research and care, outreach, education, and advocacy. So we do everything from taking care of kids, on the sidelines and when they're injured and getting them back to sport, working with all the schools and their athletic trainers, and the school nurses as well in terms of return to learn. But then also, working with our colleagues in the American Academy of Pediatrics and any advocacy issues, in Harrisburg, and then even on Capitol Hill. And then really trying to just raise awareness as to both what we do know and what we're learning about concussions so that patients, parents, their families, all the people that interact with them, whether it's teachers, guidance counselors, or even their general pediatricians, that they're up to date with what's just a rapidly changing field. As you can imagine, there's just so much that's being learned, so much that's being put out by so many people, not just us. So we try and make sure that they know what we're learning as a group so that they can be up to date, so they're not working on old information. So it's been really a great, fun experience, a fun time, learning a lot and interacting with lots of patients and families and groups of people who work with kids with concussion.
Yeah, it sounds like a really comprehensive program. Definitely something I think everybody who's attending SNS will be excited to hear about all those different components because they're so important, from the advocacy piece to the patient care piece to the education piece.
Yeah.
So I'm sure you'll get a lot of follow-up questions about the program in Philly. Um, Now, part of, what you're talking about is really how over time we've all really come to appreciate the importance of a multimodal assessment in concussion identification and management. Do you mind telling us a little bit about like ocular functioning, why this is such a critical piece of the puzzle?
Yeah, we've been really fortunate in that that has been an area that we hit upon pretty early on because of the feedback that our patients and families were giving us, that was something that they were really noticing in terms of affecting them in returning back to, full function in school and improving their symptoms and activities. And we were lucky that in Philadelphia, we are able to collaborate with Mitchell Scheinman, who is a developmental optometrist who is really the world's expert on convergence insufficiency. And what we realized was that once we started looking for these deficits, we were finding them. And I think that that's really the issue. We're trying to make sure we get the message out there that visual and oculomotor function isn't just about visual acuity and being 20/20, which usually isn't affected in concussion so much, but that actually it's about the higher level integration of visual function. So binocular visual coordination, the integration of vision with the vestibular system and vestibular function, and how the oculomotor system really bridges both of those systems, and that gets affected after concussion, and also probably interacts developmentally with kids because the visual and the vestibular systems are still developing in your childhood into your adolescent years. And so at CHOP, we're fortunate, I guess if you can put it that way, to be able to have the opportunity to take care of a lot of kids, not just college age and teenaged kids, but also younger adolescents and pre-adolescents and school-aged kids, even down to the really young kids, where we'll even see toddlers who present with what appears to be a concussion based on their parental description. And so when you start to look all across that age range, you really appreciate the fact that there is both the injury and the factors related to the injury, and then the way that that interacts with where they are in development, and whether that development is, a little bit ahead of the game, compared to their peers, or a little bit behind the game compared to their peers. And then that subtlety is important too, because, certainly there are kids who have delays in those developments, but there are kids who are just in that, range, of higher than average, lower than average. And then you have a concussion, and that can really highlight those visual and vestibular issues that maybe still be developing. And so we've been excited to be able to identify them and then actually really try and address them with rehabilitation therapies. And that's been a great approach for our patients and their families in terms of trying to optimize their outcomes.
Mm-hmm. Yeah, really, like when you were talking about, it's like that true translational research where it's being
Yeah.
informed by that patient care, and then you're able
Yep.
to take that, do research on it, and then start to develop those treatments.
Yeah.
So kind of incorporating that feedback, I think that's so important.
Yeah.
And, kind of lastly, what do you hope that the neuropsychologists attending SNS can kind of take away from this talk, whether it be about the program or just appreciating, the different functioning of the system across, like you said, different developmental periods? What's the big takeaway for neuropsychologists?
Yeah, no, I mean, I feel like our neuropsychologist, we have an embedded neuropsychologist in our program, Dr. Mary I.M. Petro, and she's such a critical member of our multidisciplinary team. And I think absolutely neuropsychologists are, completely preaching to the choir when I talk about developmental issues, and concussion, how they integrate and have an interplay in terms of the impact on outcomes. And so I hope that people who come to the talk and come to the conference will just really recognize how that interdisciplinary team really is growing. It's not just sports medicine folks that are, in the field taking care of these kids, also neurologists, also optometrists, ophthalmologists. And really, I think it does take a village to take care of these kids. And so when we've had the opportunity to essentially integrate a neuropsychologist into our concussion team, it really adds an incredible additional dimension to taking care of kids. And so I think recognizing how the neurocognitive aspects interact with the visual and the vestibular has been really incredibly rewarding for us in both our clinical implementation as well as our research. And so we've been really excited that we've been able to do that in our work. And so hopefully, I know there are a lot of other people out there doing that kind of work as well. And so I'm looking forward to learning from them at the conference too. And hopefully there'll be lots of really great up-to-date and new information that just really gets at the fact that when you're taking care of a brain injury like concussion is, there are so many aspects that you have to cover that are important to address, for patients in order to optimize their outcomes. And then you add in that developmental piece with kids, and it gets really, really interesting pretty quick, and really requires a big team.
Yeah. Yeah, it's definitely the symposium is going to be a good opportunity for that kind of discussion across different specialty areas, kind of
Yeah,
sharing this type of
absolutely.
information.
Yeah.
Yeah. All right. Well, Dr. Master, thanks again for speaking with me. Look forward to learning more about concussion, vision, these multidisciplinary teams of care at the SNS Symposium in Philadelphia this May. Those of you listening can read more about the conference and register to attend on the SNS website, which is sportsneuropsychologysociety.com. And you can also follow SNS on Facebook and Twitter for updates. So look forward to seeing you at the conference in May.
Yeah, really looking forward to seeing everybody in Philadelphia in May.